areas are at the moment it is scientifically driven pretty much, right? But we equally look at focusing more on adults who have been unable to quit, right? But on the other hand, many would say that we see young people jumping on vapes as well, which is counterproductive on what it is we want to achieve. So what would you have to say with regard to those who are saying whatever it is you're trying to achieve is not working out because you're seeing more young people getting into it anyway?
Yeah, absolutely. I concur with that. At the same time, harm reduction as a principle, it's a pragmatic principle of trying to reduce harm. And if you do recall, just to take you back when the era of HIV/AIDS and the introduction of condoms, just to give an example, there were so many counter-arguments that condoms will promote immorality. But from a public health angle, it was very clear that using a condom was safer. It did not necessarily say that it was 100% safe, but it was safer to use a condom. And even giving another example of IV drug users and the methadone program run by the government Ministry of Health that targets users of opiates and needle exchange programs. There are quite a number of counter-arguments that this will promote. Mm-hmm. What we need to do in as far as safer alternatives for tobacco is to come out with regulations that will protect the youth and children from access. And as harm reduction society, we are saying that if you do not use these products, if you do not smoke, please don't start. We advocate for those who are smokers of cigarettes and who want to quit. And we are saying that they need to be given that opportunity to use these safer alternatives that will assist them to quit. Just to give you an example, in England, in the UK, they have a program called Swap to Stop, whereby the government of UK is providing free electronic cigarettes to cigarette smokers. You walk into a clinic, they have cessation clinics all over. You walk into a clinic and you get a free vape, a free regulated vape, and then you're followed up in that clinic. Number one, to ensure that you put down your cigarette, because without a doubt the cigarette is more harmful than the electronic cigarette they are giving you. And this has been done through science. At the same time, if you look at Japan, they are coming up with regulations of protecting their youth from smoking. For example, some of the electronic cigarettes have biometrics. For you to use that, you must put in your fingerprint and other modalities to try and protect the youth from accessing these products. And that is what we are advocating for, focusing more on the smokers of cigarettes to try and assist them quit by use of these harm reduction strategies. And that is what we are saying. We need to distinguish between combustion of cigarettes and these safer alternatives.
Yeah. Mm-hmm.